Being a founding member of AFENET, Ghana has contributed significantly to 20 years of transforming Africa through field epidemiology training and public health service delivery. As a regional training program, I walk in pride seeing our residents and alumni respond to various public health challenges, including outbreak investigation and response in West Africa and Africa at large. We celebrate 20 years of strengthening public health surveillance and laboratory system, 20 years of enhancing prevention, detection, and management of non-communicable diseases, 20 years of promoting universal health coverage, 20 years of advancing the One Health approach and climate change mitigation, 20 years of promoting public health research, innovation, publication, and networking. We are proud of contribution towards our vision of a healthier Africa. I am Professor Ernest Kinu, and I am AFENET.
I'm a founding father of AFENET and the field coordinator of the Ghana Field Epidemiology and Laboratory Training Program. I have trained and helped to shape the lives of 17 cohorts of advanced trainees, 8 cohorts of intermediate trainees who have become seasoned epidemiologists, and 19 cohorts of frontline trainees. I have had the opportunity of seeing AFENET grow from a small organization with 4 African member countries to a massive one which now boasts of presence in 40 African countries. Its goal of strengthening field epidemiology and public health laboratory capacity to address major public health problems in Africa has been achieved in the expansion we've seen in the 20 years of its existence. I know and believe that further expansion would be achieved in the coming years, and we shall have a workforce that is up to the task should any public health problem arise in any part of the African continent. As we celebrate the 20 years anniversary of AFENET this year, 2025, I would like to applaud all the founding fathers whose vision and perseverance have made it possible for us to come this far. Also, the various chief executives and board members whose direction has made us chalk all the successes we can boast of today. I am Dr. Samuel Okosaki. I'm AFENET and a proud one at that.
My first encounter with AFENET was when I attended the first GFELT scientific conference. Hello, my name is Mavis Osafo, the Risk Communication Lead. The depth of knowledge in public health surveillance and field epidemiology displayed in presentations by the graduating residents was enlightening. Joining the team and working closely with AFENET on the Global Health Security Phase 2 project has given me the opportunity to share my knowledge and skills in risk communication and community engagement with the frontline and intermediate residents and other public health professionals in Ghana. I'm excited to be part of AFENET's 20 years journey and its contribution to global health security across Africa. Today, I can confidently say that I'm a proud member of the AFENET family.
After completing my MPH at the Makerere University in Uganda, I was excited to take up a position at the Ghana FELTP, another founding member of AFENET. This was an opportunity to give back to AFENET by impacting knowledge and skills to the next generation. Over the past 7 years, I have been privileged to work as a health workforce coordinator for the intermediate and frontline tiers of the Ghana FELTP. Through this role, I have contributed to the training of over 400 frontline health workers who have been instrumental in improving surveillance and outbreak response to public health issues in Ghana and beyond. AFENET's contribution to disease prevention, detection and response, and research capacity building across Africa over the past 2 decades cannot be quantified. Happy 20th anniversary, AFENET. My name is Madeleine Akos Odikro, and I am proud to be AFENET.
Through my intermediate FETP training, I have learned how to positively impact the lives of others through surveillance activities, including outbreak investigations and related public health interventions. In my current role supporting the FETP intermediate training, I am proud to contribute to AFENET's mission of building the capacity of the next generation of public health professionals, equipping them to effectively respond to public health emergencies. As AFENET celebrates 20 years of impactful service, I am honored to have played a part of this remarkable journey and its continued success. I am Jennifer Naidowetin. I am AFENET.
I'm Professor Colonel Edwin Andrew Safari, retired, first coordinator of the Ghana Field Epidemiology and Laboratory Training Program, GFELTP. I have seen the growth of GFELTP through a frontline, intermediate, and advanced FETP in 20 years. 20 years ago, when we met to discuss the creation of AFENET in Accra, Ghana, we had a dream of a healthier Africa. Seeing this dream materializing gives me much satisfaction. I've had the opportunity to contribute to the growth of AFENET from 4 to 40 member countries, training public health workers, and providing essential public health services across Africa and beyond over the past 20 years. AFENET has been a pace setter in field epidemiology and in Ghana, West Africa, and Africa as a whole, transforming the public health system in Africa into a resilient workforce with disease detectives ready facing emergency public health threats. As one of the founding fathers of AFENET, I am confident that we are in safe hands as a continent. No public health threat is too much for the army of disease detectives we have trained. As we celebrate 20 years of excellence in 2025, I would like to pay tribute to all those who have contributed in diverse ways to making AFENET what it is today. I urge us all to reflect on the journey and identify ways to strengthen our efforts to achieve our goal of strengthening field epidemiology and public health laboratory capacity to address major public health threats in Africa. I am a proud founding father of AFENET. Happy 20th anniversary to us all.
As a scientific writer for AFENET, I've had the opportunity of training the public health workforce across Africa. Being part of AFENET has helped me achieve my dream of impacting the lives of several people in different settings. We continue to tell the AFENET story and document the successes of the network over the past 20 years. I am happy to be part of 20 years of changing lives across the African continent. I am Delia Bando, and I am AFENET.
My name is Dr. Charles Longanora, an alumnus of the Ghana FETP program, Advanced Cohort 7. I'm currently a lecturer at the University of Ghana School of Public Health and serve as field coordinator for the Ghana FETP program. Since joining AFENET, I have contributed to strengthening public health systems through field research, workforce training, and emergency response across West Africa and in particular Ghana. I have supported in investigating hepatitis B transmission, IHR implementation, and COVID-19 surveillance and response, among other epidemics. My work has shown me that disease control goes beyond pathogens. It involves people's perceptions and systems. Engaging communities, mentoring future epidemiologists, and working with partners globally and across Africa have deepened my commitment to building resilient health systems. As AFENET marks 20 years of impact, I'm proud to be a part of this transformative journey. Happy anniversary to everyone.
Having joined the team as an IT support prior to the COVID-19 pandemic, the experience and exposure has significantly impacted and unearthed great potential in me. Supporting with the design of tools and data management to influence several public health reforms and policies to setting up IT infrastructure for public health EOCs to support coordinating the preparedness, response, and recovery processes for public health emergencies within the country. AFENET continues to inspire all to building a healthier Africa. Cheers to 20 years of great impact across the African region. I am Seth Edward Reinhold. I am AFENET.
As a fresh graduate in 2022, joining the AFENET Ghana team gave me a unique opportunity to apply theory to real-world public health challenges. From working in multidisciplinary epidemiological research teams to participating in outbreak investigations, like the yellow fever response in the Ahafo region, my journey with AFENET has shaped my growth as an epidemiologist. Through the intermediate field epidemiology training program, I have built hands-on skills in data analysis, field investigations, and community engagement. Skills I now use to support disease prevention and control efforts across Ghana. AFENET has not only trained me, but has also empowered me to make meaningful contributions to its vision of building a healthier Africa. I am William Kwamewitz, and I am proud to say I am AFENET.
I joined the team 5 years ago after attending the AFENET Scientific Conference that truly inspired me and opened the door to an incredible opportunity. Since then, I have been proud to serve as both the administrative assistant and the field epidemiologist. I've had the privilege of being involved in outbreak investigations, working alongside dedicated professionals to respond to public health threats. One of the most fulfilling aspects of my role has been to join the team to train frontline and intermediate health staff to become field epidemiologists themselves, helping build the next generation to respond to public health threats. It's a job I genuinely love, and I'm grateful to be part of a team that makes a real difference. Happy 20th to us. I am Martha Aka from POM, and I am AFENET.
I serve as the Global Health Security Technical Advisor for Workforce Development, Emergency Management and Response. I also serve as the Resident Advisor for the Ghana Field Epidemiology and Laboratory Regional Training Program. Our mandate as a training program is to help member countries to prevent, detect and respond to public health diseases and events, and eventually we want them to improve the public health systems in their various countries. I joined AFENET in 2015. Through working with AFENET, I have come to appreciate the fact that finding the causative agent and factors contributing to disease occurrence in any setting can be very complex. Prevention, control and treatment are not just by creating a vaccine or a drug. However, social determinants of health and communicable and non-communicable diseases play a major role in driving such complexities. Through my interaction, community, and lessons learned from my experience in over 25 countries, I have learned to empathize with the communities we work with and to also understand that not only are we fighting a disease, but also fighting the misconceptions surrounding the diseases. As we celebrate our 20th anniversary, I would like to confidently say that the knowledge and experience I've acquired through working with AFENET, and especially in disease detection and response, resource mobilization, diplomatic engagement, and many others, have contributed immensely to my ability to play key roles in enhancing public health in the Afro region and beyond. Happy anniversary to us. My name is Joseph Asamoah Frimpong, and I am AFENET.